I'm Daniel Taylor. With the proliferation and relative ubiquity of personal computing comes a movement towards replacing hands-on animal and human dissection activities in the gross anatomy and biology laboratories with virtual simulations. In this presentation, we will look at some of the available software options for such technology, review the prevailing arguments about its use, both pro and con, and discuss the appropriate use of virtual dissection technology in the anatomy laboratory. A variety of resources are available that virtually replicate almost any type of dissection via a computer program, internet web page, and even smartphone apps. Available programs range from the passive, like videos of animal and human cadaver dissections available online, to the active, like simulations of rat, frog, fetal pig, and cat dissections. The student is able to use the mouse as a virtual scalpel, making incisions and seeing the resulting views. Human dissection programs are also available and allow for a streamlined and highly organized perspective of the body parts and systems. Publisher McGraw-Hill has such a program called Anatomy and Physiology Revealed, which allows for the breakdown of the human body by layers, by system, and by sections. Histological slides are included when appropriate, and the program includes knowledge quizzes which can be taken after reviewing a section. Professors can set up their own customizable learning experiences in this program by selecting from the list of available activities and then sending their students a code to enter to access them. With new technologies comes debate, and the use of virtual dissections is no exception. Proponents of the increased use of such programs give several reasons supporting their assertions: the reduced cost to schools that virtual labs offer, the ethical consideration of sacrificing animals for routine biological study by students, and the uncomfortable sounds, smells, sights, and emotions that are often present in hands-on dissection. Opponents to replacement of actual dissection note that the aha moment that often comes during dissection is absent in virtual dissection. This may be because of the intent of the educational experience. That is, the virtual program is designed to specifically lead the student to a learning outcome, whereas the actual animal carcass is designed to provide an animal with life, leaving any educational benefit purely incidental. Thus, the latter option tends to be less streamlined, more challenging, and, once initial feelings of revulsion have passed, more rewarding and exciting. The encumbrance of real dissection is also lost in virtual programs. That is, when scalpel use is replaced with a mouse click, many of the tactile challenges of dealing with biological material are not being encountered. Learning to overcome these challenges helps students learn to interact and understand the world as it is, not as we care to represent it, similar to the difference between seeing a painted landscape and taking a walk in the countryside. Studies comparing the results of virtual and hands-on dissections seem to agree that learning objectives are met equally well by either method, according to a summary published by the Humane Society of the United States. It seems, then, that virtual dissection laboratories can be used to replace certain redundant activities or trivial activities, providing reinforcement and clarity from the confusion of organic material. Assigning dissection assignments in such a virtual environment can help students understand difficult concepts, or even prepare for an in-person laboratory experience. Yet the judicious use of hands-on dissections still provides useful information. No one would argue that textbooks, lectures, activities, conversations, and real-world experiences all have their places in education. Similarly, it seems that virtual and real dissection experiences are both useful in the anatomy laboratory, and ideally should both be used.